we have to discriminate between acute cough and chronic cough. Chronic cough, usually it's the cough that lasts more than a month and a half to 2 months. This probably you should see a physician for that to clarify what are the etiology, which is usually a chronic reason. The acute, it depends on the severity. Let's say someone is coughing, have fever, or having fevers, or having shortness of breathing. This could be pneumonia, so obviously they have to seek medical advice. So it depends on the severity and the acuity, or if it does not get better with antibiotic. Let's say somebody's getting antibiotics for a few weeks and then the cough continues, then obviously there is something else going on and they need to seek medical advice.